While smoking is widely recognized as a leading cause of lung cancer, it's important to acknowledge that even non-smokers are increasingly being diagnosed with this disease. This raises concerns and prompts a closer examination of other contributing factors.
Lung cancer is a disease which usually occurs in smokers. This is a known fact. But as on today, we are seeing more and more patients who are getting affected with lung cancer, but they're never smoked in their lifetime. So the main causes for this cancer in non-smokers is basically second-hand smoke is one thing which is very common. Means which means that the person might not have smoked in his lifetime, but the people surrounding him, maybe his family members, his friends or peers, they might have smoked, and then because of their exposure to that smoke, this person might have affected with that cancer. Second thing is occupational exposure to certain chemicals like asbestos. The people who are working in certain industries like cement industries or paint industries, they are exposed to certain chemicals which are carcinogenic, and then secondary to that, they might get these cancers. Third most important thing is because of the pollution which we see in our day-to-day life when we go outside, because of various pollutants which are polluting our atmosphere. Exposure to those particular pollutants can also cause lung cancer. And fourth and most important cause is, suppose if a person is affected with some long-term infectious conditions like COPD, chronic obstructive pulmonary disease, or pulmonary fibrosis of the lung, or chronic tuberculosis, which have been there in the past history, and that got cured, but the lung underwent significant chronic inflammation. Because of that continuous and significant inflammation, over a period of time, that can get converted into cancer. So,
early intervention and the right diagnostic tests play a vital role in detecting lung cancer before it advances.
Certain symptoms like cough, shortness of breath, or the chest pain, which are not going away with regular medications and regular treatment, if it is persisting, even after repeated multiple hospital visits, then we may have to do a routine imaging like chest X-ray or CT scan, and then based on that, we may be able to identify these cancers at an early stage. So one thing is, if a particular respiratory symptom is there in a particular person, and if it is not going away with regular treatment, then they have to go for evaluation and then find out what is wrong with the lung.
Family history and genetics are also significant when it comes to lung cancer in non-smokers. Understanding these risk factors can help in taking preventive measures and seeking early medical advice.
There are certain genetic factors. Maybe some are known, some are unknown. It is very difficult to know which genetic factor, genetic mutation is running in the families. But if there is a family history of some cancers, and that particular family members are at a higher risk of getting lung cancer. Not only lung cancer, they may get many other cancers. Among them, lung cancer is also one among them.
The approach to treating lung cancer has evolved, with new technologies allowing for more personalized treatments. Identifying specific genetic mutations in patients can lead to targeted therapies that offer better outcomes.
The treatment of lung cancer depends on staging. So once we diagnose the patient of lung cancer, then we'll try to stage the disease with the help of imaging investigations like CT scans or the PET CTs. Depending on that, we'll stage the disease as stage 1, 2, 3, or 4. Depending on the stages, we'll try to formulate our treatment plan, whether surgery followed by chemotherapy or radiation, or only chemotherapy in patients with stage 4 disease, or certain patients of lung cancer has got some genetic mutations which occur only in that particular patient, wherein secondary to that mutation, the person might have got the cancer. So we'll try to identify those mutations and then see if we can target those mutations and then treat accordingly. For example, EGFR mutation, which is commonly seen in never smokers or non-smokers. So if we can identify this particular EGFR mutation, we'll be able to target that particular mutation with the help of EGFR inhibitors like osimertinib or erlotinib. These are the drugs which target specifically those EGFR mutations.